Today, we're going to talk about a topic that's currently under public discussion: the idea of egg freezing as a reproductive strategy for women. You may have seen that entrepreneur Upasana recently advised young women to freeze eggs so they can choose when to have children and focus on their careers. Her comments sparked a wide debate, on one hand about empowerment and choice, and on the other hand about biology, cost, and realistic expectations. As someone with almost 40 years of experience, I want to give you a balanced, evidence based, clinic insider view: what egg freezing can do, what it cannot, when it makes sense, and what questions you should ask if you're considering it. Why is egg freezing getting attention now? Modern women are often delaying childbearing because of career, education, relationships, financial stability, or other life choice. In the public comment I referenced, Upasana described egg freezing as the biggest insurance for women because then you can choose when to get married, when you want to have kids, on your own terms, when you are financially independent. As a woman ages, her egg quantity and quality decline, especially after age tilde 35, making natural conception or successful IVF less likely. Freezing eggs earlier may preserve more competent eggs for future use. What egg freezing does, the benefits: it gives a woman additional reproductive flexibility. You're not completely at the mercy of your biological clock for the timing of conception. It may alleviate time pressure. If you're focusing on career, education, travel, or haven't found the right partner yet, you can choose to preserve eggs when you're younger. From a clinic lab perspective, vitrification, modern rapid freezing, has improved survival of thawed eggs, and for selected patients, the outcomes are good. As a specialist embryologist, I emphasize: when done under the right conditions, good ovarian reserve, younger age, high quality lab, egg freezing makes sense. What egg freezing does not guarantee: realistic limitations. It is not a guarantee of a future live baby. Even if eggs are frozen, future success depends on many factors: number of eggs frozen, age at freezing, eggs quality, uterine and general health at time of use, etc. Some doctors have pointed this out in the debate. Cost, procedures, storage, future thawing, IVF cycles, all incur cost. The comment made in the media: egg freezing costs lakhs upfront plus annual storage charges. Most young women listening to you can't afford even one attempt. Biology still matters. Older age brings additional risks: uterine receptivity, general health, pregnancy risk, even if you use younger frozen eggs. Delaying too long has risks. Freezing early helps, but waiting too long to use those eggs or delaying other fertility factors may still reduce chances. Not a substitute for healthy lifestyle, fertility assessment, and timely decision making. When might egg freezing be especially wise from an embryologist's perspective? If a woman is under tilde 35 years, has good ovarian reserve, and knows she wants children but is delaying for valid personal or professional reasons. If there are medical reasons to preserve fertility, example, a diagnosis requiring gonadotoxic treatment or early diminished ovarian reserve. Times, if you have financial and emotional readiness, you understand costs, potential outcomes, plan for future. If you had a fertility consultation, ovarian reserve testing, AMH, FSH, unfilled follicle count, lifestyle review, and the clinic has good vitrification infrastructure and expertise. What to ask your clinic embryology team? Book key question: what is your survival rate for frozen thawed eggs in your lab? What is your usage rate? How many women actually return and use their frozen eggs? What is your live birth rate per thawed egg or per cycle when eggs were frozen at X age? What are your storage costs, annual charges, and policies for long-term storage? What is the consent process? What are your protocols for thawing, fertilization, embryo culture? What is the estimated total cost, freezing, storage, future IVF, and payment timelines? Are there any age limits in your center for using the eggs or transferring embryos? What is your counseling process? Do you explain risks, chances, alternatives? My key take home message for you, if I summarize: Egg freezing can be a smart proactive move when you are informed, when you have the right timing, when you have good ovarian reserve, and you understand the costs and limitations. It is not a free pass or a guarantee. It should be part of a broader fertility planning conversation, not a set and forget strategy. In light of the public debate, yes, the message of autonomy and choice is valid. Women should have the ability to plan their fertility timeline. But the biology, costs, and lab realities need to be properly understood. That's when experienced IVF embryology team comes in. If you'd like to explore whether egg freezing is a good option for you, given your age, ovarian status, career life goals, and budget, our team at the Malpani Infertility Clinic is happy to help. You can chat with our IVF chatbot to begin the conversation. You can also schedule a one-on-one consultation with me or our IVF specialists. Remember, informed planning is power. Don't let the clock just tick, but also don't rush blindly. Choose wisely.